This is a 62 years old male patient, known case of diabetes hypertension, now presented with the ST elevation MI in 2-3 AVF, V5, V6, 1 AVL leads, and you can see there is a thrombotic lesion in the OM2, and there is a 100% occlusion in the LAD. This is a yellow caudal view. This is a AP caudal view, and you can see the 100% total occlusion in the LAD since proximal, and there's a thrombotic almost 90% occlusion in the OM2. So this is the RO lateral view, and you can see the same thing. And this was the RCA non-dominant, LCX was the dominant. This patient presented with the 4 hours of chest pain, and then we decided to do the angioplasty to LCX and LAD. So this is the BMW PTCA wire with the right radial root. We started the angioplasty, and this is the whisper wire, and it took me 15 minutes to cross the lesion in the LAD. But even after the crossing wire, the LED has not opened. So we did the serial balloon dilatation with the NC balloon. The same thing we could see here. The LED wire has been crossed, but there's no flow in LED. So this is a balloon dilatation. So after NC balloon dilatation, some flow has come up in the LED. And you could see the flow has been established, but the distal LED was very small. So this is you can see the distal LED is very thinned out, and this is the RO cranial view. You can see the wire has crossed till the distal LED. The same thing you could see, the LED has opened up proximally. So now here we decided to put the stent in the proximal LED. So we have taken the stent of 2.75 into 20, and you could see this is the positioning of the stent. And in this AP caudal view, we inflated the stent. You can see stent is being deployed, and this is the picture after the stent deployment. You can see the proximal LED has opened up, and due to diabetes, this distal LED is thinned out. You can see. So there was a TME3 flow after angioplasty of the proximal LED. So this is the flow in LED. Then we cross the wire into the OM2, and this is the positioning of the stent. Stent is 2.5 into 20. So this is in the proximal OM2. So stent is being deployed in the proximal OM2. So this is the picture after the stent deployment, and now we decided to overlap the stent in OM2 and in LCX. And then this was the placement of the stent, which we supposed to overlap with the lower stent. This is LCX, from LCX to OM2, and this is a deployment of the stent. Stent is being deployed. So this is the picture after the stent deployment, and we overlap the stent. So one stent is in proximal OM2, and the second stent in LCX to OM2, and we overlapped the stent in this way. This is the angioplasty to LAD and OM2 and LCX, and this is the final shot. So you can see there's a TME3 flow in LAD, which was 100% occluded, and LCX there was a thrombotic occlusions, and OM2. So this was the angioplasty to LAD, LCX and OM2.